Alagille Syndrome by Seb. Normal functioning of the affected body system. The digestive system plays an important role in absorption of nutrients into the body. It takes the food we ingest, breaks it down mechanically and chemically in the mouth and the stomach. It then absorbs nutrients, fats, proteins, and water in the intestines before eliminating them through waste through the rectum. What is Alagille syndrome? Alagille syndrome is a disease/disorder that affects many different organs throughout the body, mostly associated with liver problems and disease, but it can also affect the heart, kidneys, spine, eyes, and pancreas, as well as some other organs. Though, mainly Alagille syndrome is a genetic disorder that can affect the liver, specifically the ducts that produce and carry bile. Bile is passed from the liver to the gallbladder and then the small intestine to digest fats. In Alagille syndrome, the bile ducts may be narrow, malformed, and reduced in number, known as bile duct paucity. Bile duct paucity is the reduction in the number of interlobular bile ducts. This reduces the amount of bile that the body has to digest important nutrients. Bile is important for it contains bile acids, which are critical for digestion and absorption of fats and fat-soluble vitamins in the small intestine. Therefore, Alagille syndrome causes problems within these bile ducts and causes blockages, which ends up to build-ups within the ducts. This causes symptoms of Alagille syndrome, which include jaundice, pale skin, loose stools, and poor growth within the first 3 months of life. Later, there is persistent jaundice, itching, fatty deposits in the skin, and stunted growth and development during the early childhood. It's a complicated disease that is inherited genetically. Thus, Alagille syndrome is mostly congenital. What causes the disease? Alagille syndrome is caused by changes or mutations in the JAG1 and NOTCH2 genes. Inheritance is autosomal dominant. However, in about half of the cases, the mutation occurs as a new change without being inherited from either parent. How does the disease interrupt the normal functioning of the affected body system? In Alagille syndrome, which in this case is the reduced flow of bile from the liver to the pancreas and then to the small intestine, this may cause problems with digesting fats and absorbing fat-soluble vitamins, such as vitamins A, D, E, and K, which in turn limits the nutrients that can be used by our cells to survive and function correctly, which then can end up leading to the various symptoms associated with Alagille syndrome. In some cases, Alagille syndrome can lead to serious illness and in some cases be fatal and lead to death to the individual. Explain how the disease interferes with the normal functioning of at least one other body system. Alagille syndrome is a genetic disorder that, as known, can affect the liver, although one of the liver's functions is to eliminate waste from the bloodstream. Thus, when the bile ducts are blocked and malformed in the liver, bile cannot exit the liver. This blockage then causes scarring. Adding to that, this scarring harms the liver's ability to eliminate waste from the bloodstream, therefore affecting the cardiovascular system. This effect of scarring and liver damage can have a snowball effect on the cardiovascular system. If not treated, can increase the chances of many different health issues and potentially even cancerous outcomes. Outline any medical treatments used to manage or cure the disease. While there is no known cure for Alagille syndrome, there are treatments that can help control symptoms. Possible treatments may include medication, such as trials of antihistamine agents, that increases the flow of bile, and careful management of diet to minimize nutrition and vitamin-related problems. In severe cases, a liver transplant may be necessary. Although there is no certain cure for the disease, there is treatments that can taper for different patients, though every patient has different levels of disease, which require their own individual solutions.